the case, how they are investigated. It means what are the investigation you will give for this patient to reach your diagnosis. Remember one thing, in case of KUB region or urinary system, you must do renal function test and an extra of KUB region. So in here there is plain extra of KUB, ultrasonogram of abdomen, IVU and cystoscopy. These are all imaging investigations. If you write down the renal function test, will that help you to reach the diagnosis? If you write down the renal function test like urinaremi or blood urea, will that help you to diagnose whether the case is renal stone or bladder calculi? Do you understand me? Are you there?
বুঝতে পারি নাই।
আপনাদেরকে যদি জিজ্ঞেস করা হয় যে কি ইনভেস্টিগেশন করতে চান, সেই ক্ষেত্রে আপনি যদি রেনাল ফাংশন টেস্ট বলেন, তাহলে কি আপনি এটা রেনাল স্টোন নাকি ব্লাডার ক্যালকুলে বুঝতে পারবেন?
না স্যার।
হ্যাঁ, তো সুতরাং you have to say the imaging investigation to diagnose the case. In case of Staghorn calculi or vesical calculus, by doing 10 extra KOB or ultrasonogram of abdomen, IVU and cystoscopy, you will reach your diagnosis. So you have to write these things, not the renal function test or anything else. Okay?
জি স্যার।
Now here is the composition. What are the composition of them? You have to write down the composition of Staghorn calculi and vesical calculi. And don't write 1 or 2. Try to specific. There is only one. If you want to write 2, 3 names, it will not be okay because there is 1, 5 now. So the one is the most common composition is calcium oxalate for Staghorn calculus and calcium phosphate for vesical calculus. Okay? And how will you treat for Staghorn calculus? What you will do? What treatment you want to do for Staghorn calculus and vesical calculus? কথা বলছেন না কেন? Staghorn calculus কি করবেন? পাইলোলিথোটমি করি না আমরা, কারণ ওখানে থাকে না, তাহলে আপনাকে পেলভিসে একটা ইনসিশন দিয়ে স্টোনটা রিমুভ করতে হবে না? বুঝতে পারছেন আমার কথা?
জি স্যার। স্যার
বলেন। বলেন কি বলতে চান? ভেসিক্যাল ক্যালকুলারের ক্ষেত্রে সিস্টোলিথোটমি করতে হবে। স্টোনটা রিমুভ করার জন্য সিস্টোলিথোটমি। এই স্টেশন সম্বন্ধে আর কোনো কথা আছে কারো? বলুন, এই স্টেশন সম্বন্ধে কারো কোনো কোয়েশ্চেন? ঠিক আছে, নেক্সটে যাচ্ছি। এটা হচ্ছে বেরিয়াম মিল এক্স-রে। If you said read the X-ray, so what will be the answer? This is a contrast X-ray of stomach with a filling defect in the region of antrum. In here, there is a filling defect. Can you see?
Yes, sir.
Okay. And the contrast has not passed onward freely or passed to the duodenum. Whatever you write, it will be taken as the correct answer. So what is your probable radiological diagnosis? Not your clinical diagnosis, radiological diagnosis. It could be carcinoma stomach affecting the gastric antrum. Okay. So here, this is the contrast X-ray, mostly barium meal X-ray. The next question is, how do you make the diagnosis confirm? You have to confirm your diagnosis. Then what you have to do for confirmation of diagnosis? What you have to do?
Biopsy.
Not only biopsy, you have to say upper GI endoscopy or esophagogastroscopy and biopsy. You have to say the procedure and the performance you have done. The procedure is upper GI endoscopy or esophagogastroscopy, and you have done biopsy. So you have to write both of these. Now, next question is, what are the 5 relevant symptoms you expect from the patient belonging to the X-ray? This is the clinical features of gastric outlet obstruction. You have to write down that for carcinoma stomach. So the features are postprandial upper abdominal discomfort. If you said upper abdominal discomfort, it will be right, but the number will be decreased for you. So you have to write postprandial upper abdominal discomfort. And other symptoms are either vomiting, hematemesis, no. You can write down vomiting, hematemesis, that will be okay. And last one is abdominal swellings, as the part is narrow enough to produce a lump, visible lump. So a palpable or visible lump will be in there. So abdominal swellings or abdominal lump, and also anorexia and weight loss. Anorexia and weight loss are the symptoms for the malignancy. So you only write down the 3, that will be enough. If you write down the upper abdominal discomfort, hematemesis, anorexia, you will get 3 to 4 number in here. But for proper, there is a 2 marks in here. So if you write down the 3 or 4, it will get the whole mark. The next question is, write down the name of operations in such case. What will be the name of operations for upper abdominal for the gastric outlet obstruction due to carcinoma stomach?
Gastrojejunostomy.
You have to complete lower partial gastrectomy with gastrojejunostomy. You have to write down the whole thing. Only gastrojejunostomy is not the answer. Okay. So either lower partial gastrectomy with gastrojejunostomy. Any question with this session? Do you have any question regarding this session?
No, sir.
Okay. These are the instruments. I will skip those on because already discussed. Here is the appliance. See the questions. Name the appliance, identify the size according to color. These are the IV cannula or intravenous cannula. And you have to write down the size according to the color. Number green, what is the number? Very good. So other one is you have to 18G. You have to write down the 18G, not 18 only. Okay. If you write down the 18 only, you will not get the proper mark. Next question is, write 3 indication of its use. What is the indication of intravenous cannula? For giving Intravenous, you have to say it, intravenous fluid, intravenous medications, and transfusion of blood. Okay. So what other materials are required to use it? For a patient requiring IV cannula, what are the other things you have to need during intravenous cannulation? Here is sterile swab with alcohol, adhesive surgical tape, syringe or infusion or transfusion set. If you give infusion set, that will be right, rather than transfusion set. How this is the most important question and mostly one number in here. So it is sterilized by either ethylene oxide gas or gamma radiation. Okay. So this is the laparoscopic instruments. Can you tell me the name? Number A is tell me the name of this instrument. This is laparoscopic metallic trocar with cannula. Okay, laparoscopic metallic trocar with cannula. Number B is what is the name of this instrument? Grasper, it is okay, but there is a special name of this instrument. It is dolphin grasper. Dolphin nose forceps. Dolphin nose forceps. See it carefully. The shape of the instrument tip is like the dolphin nose. Have you seen? Can you identify? This is the dolphin. So it is called dolphin nose forceps. And what is the name of this instrument? Number C?
So clip applicator.
Metallic clip applicator. Write down the names. Metallic clip applicator. So number A is laparoscopic metallic trocar with cannula. Number B is dolphin nose forceps. And number C is metallic clip applicator. All these names you will find in the Makhonlal. There will be a lot of instruments, but don't go through all. Follow the ones I am saying. So write one use of each. What we do with number A? For creation of pneumoperitoneum or to use laparoscopic instruments. What is the use of number B during laparoscopic cholecystectomy? To hold the structures like the gallbladder and cystic duct, cystic artery, we hold with the number B. And what is the use of number C? To occlude cystic duct or cystic artery during laparoscopic cholecystectomy. Okay? বুঝতে পেরেছেন আপনারা?
জি স্যার।
ঠিক আছে। How they are sterilized? This is the most important question. See, in the number 3, there is overnight of 4 to 8 hours immersion in 2% glutaraldehyde solution for first case, with 15-minute immersion for subsequent cases. You have to write down the whole thing. Overnight, 4 or 8 hours immersion. This means you can keep the instruments in 2% glutaraldehyde solution overnight, that is around 8 hours. Or if you get only 5 to 6 hours, give it to the 4 hours. So you record overnight or 4 to 8 hours immersion, where in 2% glutaraldehyde solution. For the first case in morning you have to do this. But for the second, third case, only 15-minute immersion will be adequate. Okay? If this instrument drop during the operation, what you will do? There is the answer in the number 4. Ask the OT staff to pick it up, clean it, re-sterilize, and use the replace it with the sterilized one. Okay? So this is the answer of this question. Any question? Any question regarding this?
স্যার এই নাম্বার ইনস্ট্রুমেন্টের ইউজটা আরেকবার একটু বললে ভালো হতো।
Pneumoperitoneum during laparoscopic surgery. For creation of pneumoperitoneum during laparoscopic surgery. This is the one use. You can also say to use the laparoscopic instruments through it. But the number 1, that is, I have said that creation of pneumoperitoneum during laparoscopic surgery is most appropriate answer. Okay? Any question? Any question regarding this station?
No, sir.
Okay. So can you see this one? Can you see?
Yes, sir.
Identify the given specimen. Can you identify the specimen?
Gallbladder.
What is this one?
Gallbladder.
Gallbladder.
Impacted with stone.
Gallbladder packed with stone. Have you seen the cut surface?
Yes, sir.
Is it lumen?
No, not
Do you
lumen.
think it's a lumen?
No.
This is a solid structure. This is testicular tumor. Have you seen the spermatic cord? Here is the spermatic cord. How can it will be gallbladder? This is the spermatic cord. Okay? Read the other questions. So, identify the given specimen with findings. This is the resected specimen of testis with part of spermatic cord. And findings: cut surface is showing a tumor involving the testis, which is gelatinous, uniform in appearance, and no evidence of extension of tumor outside the testicular capsule. There is no outmerged of the tumor. The tumor is not growth outside or outer part of the testis. And this is gelatinous smooth part. So what will seminoma? Testicular tumor, seminoma. You have to write this one. What operation has been performed here? Radical inguinal orchidectomy via an inguinal incision. Radical inguinal orchidectomy. This is the name of operation via an inguinal incision. The name of incision is inguinal incision. Now came the possible clinical features. What are the clinical features for this patient? What are the clinical features for this patient? There will be painless testicular swelling, heaviness of testis, loss of testicular sensation. These are for the testicular tumor. But if there is signs of metastasis or features of metastasis, there will be abdominal lump, chest pain, and hemoptysis. Okay? টেস্টিকুলার টিউমার কি কম পড়া হয়েছে? কথা বলছেন না কেন? কি? এখন আসেন, what investigations were performed to diagnose the disease? These are the investigations. First, you have to do the ultrasonogram of scrotum and abdomen. Then go for tumor markers. After that, if required FADC, and to exclude the metastasis, you have to do the chest X-ray and CT scan of abdomen. Okay? বুঝা গেল?
জি স্যার।
Specimen কিন্তু থাকবে, বারবার বলছি। There is another specimen. What is it? What? Identify the specimen.
Testis.
What is the specimen?
TC মনে হচ্ছে স্যার।
বুঝলাম না, বলেন।
ব্রেস্ট হবে।
এর আগে কি বললেন? এর আগে কি বললেন? আপনাকে বলা হয়েছে আইডেন্টিফাই দ্য স্পেসিমেন। আপনাকে বলতে হবে যে স্পেসিমেনটা কি। শুধু ব্রেস্ট বললে তো হবে না। কোয়েশ্চেনটা দেখেন কি লেখা আছে, আইডেন্টিফাই দ্য স্পেসিমেন মেনশনিং देयर পার্টস। কি হবে বলেন? বলেন।
Excised part of breast containing the nipple and areola.
Nipple and areola, then
elliptical shaped skin and
nipple,
underlying
areola, part of skin, and
Axillary lymph node.
what is the axillary
Scale of
lymph
breast.
node? Very good. So you have to say all these things. What operation has been done here? Name the operation.
Partial mastectomy.
Is there any operation named partial mastectomy? Have you found any term using partial mastectomy in any book?
Simple mastectomy.
Simple mastectomy, okay. With
Axillary dissection.
Axillary dissection. What is the absolute indication of this operation?
Carcinoma breast, stage 1 and 2.
Stage 1 and 2. Okay. What structures are carefully preserved during this operation?
Intercostal nerve.
Okay. Number 1, intercostal nerve. Then, is it essential? Which structures are most essential to preserve?
Nerve to latissimus dorsi.
Okay, very good. And
Nerve to serratus anterior.
okay. The nerve to latissimus dorsi, nerve to serratus anterior, and last one is intercostobrachial nerve. Okay. Any question regarding this station?
No, sir.
Okay. Come to the next one. Can you identify the X-ray with radiological findings? What is the name of this X-ray? Read one. Just read out the X-ray. This is a plain X-ray of abdomen. Then, what are the findings? There is a huge gas shadow. There is a huge gas shadow. What is the shape of this shadow? Tire shape. So next question is, write down the diagnosis. What could be the probable diagnosis
Volvulus.
of
The large
volvulus
intestine.
of which organ or which part of intestine?
The large intestine.
You have to say sigmoid volvulus. Okay. So if the findings of X-ray you have to write down, this is the plain X-ray of abdomen in erect posture, AP view or anterior posterior view showing huge gas distended bowel loop. See, there is the huge gas distended bowel loop, and there is some hostrations in here. Have you seen? There is hostrations in both right and left sides. These are all the hostrations. Where are the hostrations we found?
So large intestine.
Large intestine. Okay. So this is the gas shadow is present in the large intestine, and there is a huge gas shadow that is star-like shape, and it is a classical findings in sigmoid volvulus. So huge gas distended bowel loop with hostration arising from the left iliac fossa. See, the hostrations are mainly mostly seen in the left side, hole in here, and also in the right side, but mostly in the left side. So if the question is, what are the cardinal features of the sigmoid volvulus? How the patient will present to you? If the patient having sigmoid volvulus, you are thinking, what will be the clinical features?
Pain.
Abdominal pain.
Distension.
Say abdominal pain. Then
Abdominal distension.
distension. Then next
So
one.
constipation, vomiting.
Absolute constipation. You have to say this one. Constipation only. There will be absolute constipation. And features of toxemia and shock. Okay. What will be the initial management? This patient came in the hospital in the emergency and the patient is got admitted, came to the ward. So what will be the initial management for this patient?
Nothing for
Nagpar oral,
and
IV
infection.
channel with IV fluid,
IV fluid, then
for pain analgesic, broad spectrum antibiotic,
okay. NG suction also. NPO, NG suction, IV fluid, then analgesic antibiotic. And what are the predisposing factors for this case? What are the predisposing factors or what are the cause? Sigmoid valvular, you must see because earlier that was shown to you. There is a loaded colon, long mesocolon. You have to see the picture from Bailey and Love, must. There is a very beautiful picture showing the cause of sigmoid volvulus. One is loaded colon, long mesocolon, narrow attachment of mesocolon, and band of adhesions. These are the predisposing factors or cause of sigmoid volvulus. Any question regarding this station?
no sir.
Here are some laparoscopic instruments. Just tell me or identify the instruments. The number is
Sir, hook.
diathermy hook. You have to complete the answer. It is a diathermy hook. Number B.
Crocodile grasper,
Number B.
crocodile grasper,
Is it crocodile grasper? It is dolphin nose forceps.
oh dolphin,
Number C. Number C is,
sir,
Crocodile.
crocodile
this is the crocodile
grasper,
grasper. And number D.
Maryland grasper.
Maryland
Very good. Maryland forceps. Number E is
fundus holding grasper,
fundus holding grasper. Very good. So next question is, name 3 operations where these instruments are used. See, in earlier questions they are asked about the use, and here you have to mention the operation name. Name 3 operations where these are used.
laparoscopic
What are the operations?
cholecystectomy,
Laparoscopic
laparoscopic cholecystectomy,
cholecystectomy.
appendicectomy,
Very good. And
laparoscopic hernioplasty.
hernioplasty. Okay. How can you sterilize these instruments?
Overnight, 4 to 8 hours, sir.
Overnight or 4 to 8 hours?
8 hours, immersion in 2% butyral dehydrate.
Very good. For the first case.
First is
And
15 minutes for the subsequent cases.
okay, 15 minutes immersion. Here is another situation, and it is data interpretation. You have to read these questions very carefully because the answer is already mentioned in the question. So if you don't go through the question properly, the station will be totally incorrect. So the question is, a 45-year-old male with long history of vomiting got admitted to the hospital for surgery. See the age of the patient. History, there is a long history of vomiting. And with this long history of vomiting, this patient has admitted in the hospital for surgery. Here is the serum electrolytes level. And the next one, some biochemical investigations are seen in here. So seeing this, what is the metabolic state of this patient?
Hyponatremia, hypokalemia,
Hyponatremia, then
hypokalemia,
kalemia,
hypochloremia,
hypochloremia,
metabolic acidosis,
metabolic acidosis.
aciduria,
alkalosis.
What is the
Metabolic
metabolic acidosis and what is metabolic alkalosis? What is the value of pH? You will see and say that it is metabolic acidosis and this is metabolic alkalosis.
In case of
Say
metabolic
acidosis.
acidosis, the pH reduces. pH compresses.
What will be the number? pH will be less than 7.
Less than 7.
That is metabolic acidosis. And more than 7 is metabolic alkalosis. Here it is metabolic alkalosis. So see the answer. Hyponatremia, hypokalemic, hypochloremic, metabolic alkalosis with paradoxical aciduria. You don't mention that one. Okay. Because his urine has the following biochemical properties. You have missed this one. So you have also missed the answer. You have to say paradoxical aciduria because the pH is 4.1 in here in urine. But in blood it is 7.9. Okay.
Yes.
How will you correct this abnormality?
Infusion,
Correction of dehydration.
potassium supplementation.
Very good. By infusing intravenous normal saline with added potassium or potassium supplement, whatever you like to see. Now, next question is, how will you prepare the patient for surgery?
Correction of dehydration, electrolyte imbalance, correction of acid-base abnormality, malnutrition, malnutrition characterization.
Okay.
Correction of metabolic alkalosis.
You have to be specific because there will not so many times that you can write all these things. Just write down the correct metabolic abnormalities with IV fluid, correct anemia by blood transfusion, improve nutritional status by parenteral nutrition, and nasogastric tube for gastric lavage. You have to write all these 4 ones or prepare the patient for surgery. Okay. Now the next question is, what will happen if surgery is performed in this state? If you don't correct all these things, just send the patient to operation theater for doing the operation. What will be the consequence or what will be the problems?
Anesthesia failure.
Sorry?
So anesthesia failure, renal failure.
Anesthetic hazard. Then renal failure. Okay. And
anastomotic leakage.
anastomotic leakage. Okay. Here are some appliances. What are these? Question 1. First, identify the given appliances.
Suture materials.
Suture materials. Okay. Number A is, what is the name of number A?
Sir, A is
Vitriol.
polyglycol.
You have to say properly. That is number 20 polyglycolic acid. Okay. Number B is?
So number 20 nylon
That is
monofilament.
number C. You have to maintain the order. What is number B?
Number B is 40 polydioxide.
Number 20.
Number 20.
Okay. Number 2 nylon.
Yes, sir.
And
These number 60 50 60 silk braided.
it is 50.
Okay, 50, sir.
Number F,
Number F is 0. Number 0 plain catgut.
there is no number 0. That is,
Oh. 1.
it is number 10.
10.
Number 10 plain catgut. Okay.
Yes, sir.
You have to see if the right is only 0, but it is number 10. Then in the number F,
Sir, number F, number 30 chromic catgut.
okay. The number G,
Number G, number 2, number 20 polypropylene.
so what will be the use of each appliance? That is
Sir,
polyglycolic acid is used for intestine anastomosis or anastomosis of intestine. 40 is also used for the anastomosis of intestine. 20 nylon and silk are used for skin, and plain catgut for circumcision. Okay, and number 1, that is polypropylene, is used for closure of the skin or tendon. So classify them according to their absorbability. Can you say which suture materials are absorbable and which are non-absorbable in here?
Sir, catgut is absorbable and silk non-absorbable.
A, E, B, and F are absorbable.
A, E, B is absorbable. Okay. Number F.
A, E, B, and F are absorbable.
Okay. And the rest one is non-absorbable. How can you sterilize?
Ethylene oxide.
Ethylene oxide or can you describe the lesion? What is this one with your diagnosis?
Sebaceous cyst.
First, you describe the lesion. There is a
Circular.
there is a
Circular
Lesion with punctum
lump or swelling on the
in the back.
back, measuring of about 1 inch in the diameter, with a punctum in the center.
when you have to say the findings, you have to say like this one. There is a spherical swelling. See the shape of the swelling. This is spherical. Spherical swelling on upper part of back, having a punctum in center with reddish inflamed surrounding skin. Okay, this is the punctum, and there is reddish inflamed skin surrounding. So what is your diagnosis? Is it? It is the
Sebaceous cyst.
there is reddish inflamed skin. So you have to see infected sebaceous cyst, not only sebaceous cyst. Okay. What are the common sites for sebaceous cyst?
Scalp, face, back, neck.
Face, neck, back. Mention sites where the lesion will not occur. where these lesions not occur.
Arms and soul.
Why?
Sir, kono
Why not occur in palm and sole?
তার ওখানে sebaceous gland
gland.
থাকে না।
No sweat gland or sebaceous gland is present in there. Okay. And how will you treat this patient?
Sir, excision of the cyst.
Excision of the cyst. So by giving elliptical incision.
Yes. Okay. Excision and biopsy, you have to say this. Complete excision of the cyst and biopsy. Okay. What complications if this patient is not get this treatment?
So infection,
Infection,
then ব্রাস্ট হয়ে যেতে পারে, then
okay,
ওখান থেকে স্যার ulceration or calcification.
okay. In here, it will be infection, bursting and reformation, and sebaceous horn may develop. And how will you treat if such lesion get infected? If the patient
Incision
has
and drainage
infected
of
sebaceous
infected
cyst,
incision and drainage
incision and drainage of infected material with secondary wound closure. You have to write the whole answer. Incision and drainage of infected material with secondary wound closure. Okay. So come to the next station. Describe the lesion.
Sir, it is an ulcerated lesion of the foot which is irregular in shape.
Then
Margins are well defined.
okay. Then
It is non-healing because granulomatous tissues can be seen.
okay. Very good. And
Skin pigmentation can be seen around the ulcer,
very good.
like ischemia.
Okay.
White like
And sir, measuring.
sloughy material can be seen.
What is your diagnosis?
There is squamous cell carcinoma of the foot.
Non-healing ulcer due to
Why non-healing ulcer? Why have you said that it is a non-healing ulcer?
sloughing as
And why you saying it is a squamous cell carcinoma?
The irregular shape and
The margin is
everted.
okay, and the surface is irregular and here is the answer. There is an ulcerated lesion in medial aspect of left foot measuring about 4 by 4 centimeter, irregular shape and everted edge, and floor is covered with slough. Mostly you have said all these things. And the answer is correct. You have said that it is a squamous cell carcinoma in left foot. You have to say that one. Non-specific ulcer or non-healing ulcer is the differential diagnosis, and another one is basal cell carcinoma. Now, what important points you will assess? Where is the stone? Here is the stone, okay? There is a retained stone in the common bile duct. Okay. What will be your treatment plan for this patient? If the patient undergone operation and their T-tube is placed, and by doing T-tube cholangiogram, you have shown there is a retained stone in the distal part of common bile duct. Now, how will you treat this patient?
ERCP.
ERCP.
The first one is ERCP. As there is a T-tube, you have to write the removal of stone by T-tube.
T-tube.
By using Dormia basket, you can say this one first. Removal of the stone via T-tube tracked by Dormia basket. If it is not possible, then we do ERCP and removal. If that also not possible, then we do re-exploration and removal of stone. Okay? And what is the aim of using this tube? Why you use T-tube after exploration of common bile duct? What is the benefit or advantage of using T-tube for this case?
Alternative drainage of bile.
And prevention of biliary peritonitis. And we can do post-operative T-tube cholangiography. That will help if there is retained stone or not. And if there is any retained stone, we can remove through this tube. Okay? বুঝে গেল?
জি স্যার।
Okay. What is this specimen? What is the name of this specimen?
লিভার
আছেন না হারাই গেছেন? বলেন।
লিভার
Describe its pathology and what is your diagnosis? Is it liver or spleen?
Spleen.
It's a spleen.
Ruptured spleen.
Ruptured spleen, very good. What is the cause of this ruptured spleen? There is traumatic injury or road traffic accident. Okay. Mention the ways or modes of clinical presentation of this condition. What is the ways or modes of clinical presentation of this condition? The patient will come with upper left abdominal pain. There will be distension. Patient may be in hemorrhagic shock. And there will be a history of road traffic accident or traumatic injury to the left lower chest. These are the clinical presentation of this case. Mention 3 important clinical signs. What will be finds for this patient? there will be bruise in the left lower chest. Tenderness, moderate to severe tenderness on the left lower upper abdomen. Patient in shock, in hemorrhagic shock mainly. Okay. Mention important measures. What are the post-operative measures you have to see for this patient? Because this patient will go for emergency laparotomy to remove the spleen, as there is ruptured spleen. You cannot save the spleen. You have to remove this spleen.
Yes, sir.
And after the operation, there are several post-operative measures you have to take. What are those?
Sir, vaccination.
Immediate post-operative measures.
Sir, immunosuppressants.
During post-operative measures, you have to check the NG tube if there is any bleeding present in the NG tube or not, because during operation there may be injury to the stomach. Okay, so you have to check the NG tube for any bleeding occur not. Give blood transfusion, as there is huge blood is lost due to trauma and after removal of spleen. So you have to give blood transfusion 1 or 2 units. And later on there is broad spectrum of antibiotic you have to give to prevent any kind of infection, because the patient will be immunosuppressed. And the last one is vaccination. Vaccination for or to prevent post-splenectomy opportunistic infection by what are the organisms?
Hepatitis.
What are the
Hepatitis.
organisms for
Pneumococcus, meningococcus are
Pneumococcus.
Haemophilus influenzae.
Very good. And E. coli. Okay. So for this we give vaccination. What is the specimen?
Sir, gallbladder, sir.
Gallbladder. Okay. But you have to describe. The question is describe and identify the structure. This is a specimen of gallbladder, which is distended, and there is also a gangrenous part is seen. Okay. Next one is, what will be the clinical presentation? If a patient having any pathology in the gallbladder, what will be the clinical presentations? What are the indications of cholecystectomy? Can you say? What are the indications of cholecystectomy? Okay.
Empyema in gallbladder.
Gallbladder. Is there any indication of doing cholecystectomy in case of acute cholecystitis?
Sir, post-typhoid.
Any indication of cholecystectomy in case of acute cholecystitis?
No, sir.
No. Why? If the patient come within 48 hours of the onset, the patient having acute cholecystitis within 48 hours, then we will go for the operation. Okay. If a diabetic patient, there is important, when or not, to prevent further complications due to diabetes. If there is uncontrolled diabetes, that patient cannot go for surgery that time, but having acute cholecystitis and the complications will be more. Here is another radiograph or imaging. What is it? What is the name of this radiograph? This is
So T-tube cholangiogram.
cholangiogram. Very good. This is like the previous one, so I will not discuss this. Instruments. Can you name what is the name of this instrument? Number A.
So Morris retractor.
Number B.
Debs retractor.
Number B is
Debs retractor.
Diverse abdominal retractor. Number C.
Cat's paw.
Number D.
Right angle.
Or Langenbeck for retractor. The 65-year-old presented with painless progressive jaundice with anorexia, weight loss and generalized itching, gallbladder palpable but non-tender. Are present. Is your
Carcinoma of the pancreas,
carcinoma?
head of the pancreas,
When you have to say provisional diagnosis, you have to say a diagnosis. Obstructive jaundice due to carcinoma, head of
the pancreas.
pancreas. Okay. Name two other possibilities. What are other possibilities for this patient?
So cholangiocarcinoma.
Cholangiocarcinoma.
What are other possibilities?
Periampulary carcinoma and
Cholangiocarcinoma.
Can it be carcinoma gallbladder?
The thing is, in the interest of financial.
Okay. What are the imaging investigation you want to do? First, in imaging investigation.
Ultrasonogram of hepatobiliary system and pancreas.
Why? What are the findings you will see in the ultrasonogram of hepatobiliary system and pancreas?
Dilated common biliary tract.
Okay. There will be both extra and intrahepatic biliary channels will be dilated. Next. What are other findings? If there is any lymphadenopathy, if there is any metastasis in the liver and ascites. In case of gallbladder, if there is any lesion, there is a lump, that will also be detected. But hardly the pancreas could be detected properly by ultrasonogram. If the lump is definite and the size of lump is more than 1 centimeter, that will be detected by the ultrasonogram. But the lump is less than 1 centimeter, that will be better identified by the CT scan. So mention 3 other imaging investigations for this patient. The first one you have said, ultrasonogram. Then any other
CT
imaging
scan.
CT scan, MRI.
CT scan of abdomen. Why MRI?
Sir, plain X-ray of abdomen.
Why plain X-ray of abdomen?
MRCP, sir, MRCP.
MRCP.
Okay, CT scan of abdomen. After ultrasonogram of abdomen, if there is any lump is present or suggestive of any mass lesion in the pancreas or gallbladder, will of course go for the CT scan of abdomen. But if there is any no other mass lesion, then we will go for MRCP. Remember this one. Any lump or mass lesion, we will go for CT scan. But no lump, we will go for MRCP. Assalamualaikum, sir. Time from this one, we class the chief sir. Class to some here after this side of Asian যেতাম sir. বলেন আর কি ইমেজিং ইনভেস্টিগেশন করবেন? ইআরসিপি করবেন? প্রোগ্রেসিভ জন্ডিস বলছেন, একটা ইআরসিপি করে স্টেন্টিং করে দিয়ে আসবেন না? তারপর না পেশেন্টটাকে আপনি প্রিপেয়ার করবেন অপারেশনের জন্য। আর যদি সম্ভব হয় কোনো বায়োপসি নেবেন না? তাহলে বলছেন না কেন?
নিব স্যার।
Okay. Here is another scenario. A 30 years old man presented with low end pain that increases on movement, along with fever and burning sensation during micturition. His routine and microscopic examination of urine shows these things. What is the most probable cause?
Sorry, UTI.
Hello?
UTI. There is RBC is plenty. How can you say it is UTI?
UTI due to
What is the most probable cause?
Renal cell carcinoma.
Renal cell carcinoma.
Ureteric stone.
See the scenario properly. There is low end pain. Patient is young man. Renal calculi. The low end pain is for, there will be pathology in the kidney, and this pain increase on movement, having fever and burning sensation during micturition. So all these things is favor for renal calculi. Okay. Name 2 imaging studies essential to evaluate this patient. Imaging investigations.
So plain X-ray QB region,
Okay, plain X-ray of QB region and
intravenous urogram.
outline the role of contrast imaging in this situation. What is the benefit of giving contrast or having contrast imaging? কি ইলেকট্রিক্যাল ইনসিশনের মেইন আপনার এমটা কি থাকবে? ইনক্লুডিং দ্য পাংক্টাম হতে হবে না? A transverse elliptical incision, the skin with punctum lies in the ellipse. আচ্ছা, কমপ্লিকেশনস কি হতে পারে বলছেন? ইনফেকশন হবে, বার্স্টিং ইনফরমেশন হবে, হোমোসাইটস এগুলো বলেছে। এটা কি? তাড়াতাড়ি বলেন, আপনি 20 মিনিট পড়াবো।
স্যার
20 মিনিট পরে শেষ।
Inflamed appendix.
যত তাড়াতাড়ি বলবেন তত তাড়াতাড়ি সবগুলি দেখবেন যে কমন পড়ে গেছে। ঠিক আছে, অ্যাপেন্ডিক্সেক্টমি এটা পড়ে নেবেন। অ্যাপেন্ডিক্সের মধ্যে যা যা জিনিস আছে এগুলো পড়ে নিতে হবে। ঠিক আছে, এটা কি? ল্যাপারোস্কোপিক মেটালিক ট্রাকা অ্যান্ড ক্যানুলা। ঠিক আছে, এটা সুচার ম্যাটেরিয়াল, এগুলো পারবেন। এটা কি বলেন তো, শুধু ছবিটা দেখে বলেন এটা কি? বলেন বলেন, এই যে এখানে আছে
Renal stone.
হ্যাঁ, স্টেগন রেনাল ক্যালকুলাই। ঠিক আছে, renal stone. A 38-year-old man presented in the surgery ward with the complaints of repeated vomiting, generalized weakness and spasm of hands and feet. Known case of gastric outlet obstruction due to pyloric stenosis. Dehydrated anemic. Laboratory investigation showing these things. What are the biochemical abnormalities? বলেন।
Hyponatremia, hypokalemia.
Hypochloremia আছে,
Chloremia.
hypocalcemia আছে,
Hypocalcemia,
metabolic acidosis আছে।
Metabolic alcohol.
ঠিক আছে, বেসিস অফ উইকনেস এন্ড স্পাজম কি? হাইপোক্যালেমিয়া এন্ড হাইপোক্যালসিমিয়া। ঠিক আছে, হাউ ইউ ক্যালকুলেট দ্য অ্যাবনর্মালিটি অফ সিরাম পটাশিয়াম? দেখেন পটাশিয়াম ডেফিসিট কিভাবে বের করতে হচ্ছে। নরমাল পটাশিয়াম লেভেল মাইনাস মেজার্ড পটাশিয়াম ইনটু বডি ওয়েট ইন কেজি ইনটু 0.4। আপনারা কি সোডিয়াম ডেফিসিট বের করতে পারেন?
না স্যার।
এটা দেখে নেবেন। পটাশিয়ামটা আমি দেখাই দিলাম, সোডিয়ামটা দেখে নেবেন, অবশ্যই দেখবেন। আচ্ছা, কারেকশন কিভাবে করবেন? নরমাল স্যালাইন উইথ পটাশিয়াম সাপ্লিমেন্টেশন। যা বলছি এখান থেকে আপনাদের কোয়েশ্চেন থাকবে, বারবার বলতেছি। এটা কি? হোয়াট ইজ দ্য স্পেসিমেন?
অ্যাপেন্ডিক্স।
অ্যাপেন্ডিক্স, ঠিক আছে। এটা কি? হ্যাঁ,
কার্সিনোমা অফ দ্য ব্রেস্ট।
কার্সিনোমা অফ দ্য ব্রেস্ট, ঠিক আছে। এই স্পেসিমেন দেখানো হয়েছে, এটা তো পারবেন। প্রক্টোস্কোপ পারবেন না?
জি
পারবেন। পরীক্ষা যেন কেউ বাদ না দেয়, কারণ এই পরীক্ষার উপরে আপনাদের পরবর্তী অ্যাসেসমেন্টের এই রেজাল্টের উপর সেন্টআপ নির্ভর করবে। এবার বলেন এটা কি? আর আমি আপনাদেরকে একটা প্রিপারেটরি স্টেশনের জিনিস পাঠিয়ে দেবো। ওটা কোথায় পাঠাবো? এখানে প্রিপারেটরি স্টেশনের মধ্যে দেখবেন যে কিছু কিছু স্টেপ লেখা আছে, যেমন গ্লাভস কিভাবে পড়তে হয়, গাউন কিভাবে পড়তে হয়, তারপর আপনার কিভাবে পড়াতে হয়, এই জিনিসগুলি সুন্দর করে গুছানো আছে। এটা কিভাবে পাঠাবো আপনাদেরকে?
ইমেল করতে।
মেইল করবো, আমাকে আপনারা একটা মেইল অ্যাড্রেস দিয়ে রাখবেন, আমি একজনকে বা দুইজনকে পাঠিয়ে দিব, বাকিরা সবাই নিয়ে নেবেন। ঠিক আছে?
জি
মামা আছে, মেইল অ্যাড্রেস পাঠান। এগুলি পড়ছেন, এগুলো আগাবো না, পড়াশোনা। এটা কি? এটা identify the extreme mentioning 3 radiological findings.
Gastric obstruction, intestinal obstructions.
Intestinal obstruction কি ধরনের intestinal obstruction? Small
Small.
intestinal,
both
small intestinal.
is
এখানে স্মল আছে, লার্জ আছে, তবে স্মল ইন্টেস্টাইনটাই বলা ভালো। স্মল ইন্টেস্টাইনাল অবস্ট্রাকশন, যেহেতু সেন্ট্রালে বেশি আছে, সেন্ট্রাল পার্টে বেশি না, এই জন্য এটা স্মল ইন্টেস্টাইনাল অবস্ট্রাকশন হবে। আচ্ছা, mention 3 causes of this condition in young adults. কি হবে? Bands adhesions হতে পারে, obstructed inguinal hernia, intestinal TB, intussusception, roundworm, bolus obstruction. Presentation কি হবে? Abdominal pain, distension, vomiting, constipation. Treatment কি করবেন? Important steps of treatment of this condition. এই পেশেন্ট আপনার কাছে আসলো, কি করবেন? Correction of dehydration করতে হবে, NG suction, catheter দিতে হবে, analgesic antibiotic আর definitive laparotomy দিয়ে যেতে হবে। এটা কনজারভেটিভ ট্রিটমেন্টে ভালো হবে না। ফাইন্ডিংসটা দেখেন সুন্দর করে। প্লেন এক্সট্রা অফ অ্যাবডোমেন অন ইরেক্ট পোশ্চার ইনক্লুডিং distended small bowel loops. Loops are centrally placed. এই কথাগুলো আপনাদের লিখতে হবে। Valvuli conniventis, multiple air fluid level, air fluid level in step ladder pattern. এই 5টা কথা আপনাকে লিখতে হবে। কথা বুঝা গেছে? ঠিক আছে?
Yes, sir.
Yes, sir.
এটা কি? এটা what is this? এটা কি জিনিস?
IV set.
ইনফিউশন সেট, এটা বলতে হবে। ইনফিউশন সেট, ঠিক আছে? এটা কি? What is this one? Endotracheal tube. What is this specimen?
A specimen of gallbladder.
Okay. What is this one?
Malignant melanoma.
yes,
basal cell carcinoma.
basal cell carcinoma.
Very good. Basal cell carcinoma is the first one. Then it could be,
Malignant
Malignant
melanoma.
melanoma.
and write 3 differential diagnoses. First one is basal cell carcinoma. Next one is squamous cell carcinoma. Why not?
Sir, because it
It
line
is squamous cell carcinoma.
normally it lies below the line joining the angle of the mouth and tragus.
Normally, but it is squamous cell carcinoma. You can say carcinoma is malignant melanoma. How will you confirm? How will you confirm the diagnosis? By excision and biopsy.
Excision and biopsy.
Okay. What is the X-ray?
So intestinal obstruction.
In X-ray abdomen.
আচ্ছা, এটা একটু দেখে নেন। ইনস্ট্রুমেন্টস গুলি কি? ব্লেড না? সার্জিক্যাল ব্লেডস নাম্বার 11, 15, 20। ওকে, আপনারা দেখবেন এখানে নাম্বার লেখা থাকে, এটা একটু দেখে নেবেন। এই যে এখানে দেখেন 11, 15, এখানে 20, 10 ও থাকতে পারে। মেনশন ওয়ান ইউজ অফ ইচ নাম্বারড ইনস্ট্রুমেন্ট। নাম্বার 11টা কি ইউজ হয়? ইনসিশন এন্ড ড্রেনেজ অফ অ্যাবসেসের ক্ষেত্রে, ঠিক আছে? আর্টারিওটমির ক্ষেত্রে ইউজ করা হয়। নাম্বার 15 is smaller incision, excision of sebaceous cyst, আর during venesection এ ব্যবহার করা হয়। Number 20 is used for longer incision and dissections. Abdominal incision এ ব্যবহার করা হবে। ওকে, এখন আসেন কোন কোন হ্যান্ডেলে কোনটা ব্যবহার করবেন। মেনশন দ্য হ্যান্ডেল নাম্বার ফর ইচ ইনস্ট্রুমেন্ট। নাম্বার 11 এর জন্য নাম্বার 3, 15 এর জন্য নাম্বার 4, 20 এর জন্য নাম্বার 5, যদি 10 হয়, নাম্বার 10 যদি হয় তাহলে হ্যান্ডেল নাম্বার 4। ঠিক আছে, বুঝতে পেরেছেন?
Yes,
জি
sir.
স্যার।
Yes, sir.
Can it be reused? Give results. কেন করা যায়? No. আপনি কিভাবে ইউজ করবেন? To prevent contamination and transmission of disease. Okay. How it is sterilized? By gamma radiation. দেখেন আপনাদের কোশ্চেন কিন্তু প্রফে রিপিট হয়। দেখেন আপনারা তো দেখতেছেন, কি মনে হচ্ছে কোশ্চেন রিপিট হচ্ছে না?
জি স্যার।
হ্যাঁ, তাইলে আমি যা অস্পি আপনাদেরকে পড়ায় দিচ্ছি, পরীক্ষার আগেও যদি পড়ানোর সুযোগ পাই, এর বাইরে থেকে আপনাদের কোনো অস্পি স্টেশন হবে না, সম্ভব না করা। এটা কি? এটা বলেন তো, what is this? Mention what is the diagnosis?
Testicular torsion.
Testicular torsion, very good. পারেন তো সব, আপনাদের আর কি পড়াবো? এটা কি? এটা কি অ্যাপ্লায়েন্স? অ্যাপ্লায়েন্সের নাম কি বলেন তো? কোলোস্টোমি ব্যাগ, স্টোমা ব্যাগ কি? এটা কি? এটা বলেন তো কি জিনিস এটা?
Volvulus.
Sigmoid volvulus. This one, এগুলি জাস্ট দেখে রাখেন। কি এটা?
Stone.
এটা কি? কি করা হচ্ছে?
Appendectomy.
ল্যাপারোস্কোপিক অ্যাপেন্ডিসেক্টমি। ইনস্ট্রুমেন্ট গুলি দেখেন সব ল্যাপারোস্কোপিক না, এটা ল্যাপারোস্কোপিক অ্যাপেন্ডিসেক্টমি করা হচ্ছে। এটা কি জিনিস?
Proctoscope.
ভেরি গুড। এটা কি জিনিস?
Blood bag.
ব্লাড ব্যাগ। আর এটা কি?
Neuro bag.
হ্যাঁ,
30%.
20% মিনিটল লিখা তো আছে, দেখছেন না? দেখে বলেন এটা কি? এটা কি পেশেন্ট?
Burn.
বার্নের পেশেন্ট। বার্ন সম্বন্ধে আপনারা সুন্দর করে রাখবেন। বার্ন আমি বেশি পড়াচ্ছি না, কারণ বার্ন আপনাদের অনেক পড়ানো হয়েছে, নতুন করে কি পড়াবো? শেষ। যা যা মোটামুটি পড়ানো সেগুলি সব বলে দিলাম। আর হচ্ছে আপনাদের কিছু কোয়েশ্চেন থাকবে, যেগুলো হচ্ছে আপনাদের যেটা যে বললাম আপনাদেরকে প্রিপারেটরি স্টেশনের মধ্যে থাকবে, ওই স্টেশনগুলি থেকে অবশ্যই দেখে নেবেন যাতে কোনোগুলি মিস না যায়। ঠিক আছে? বুঝতে গেল? কথা বলা নাকি?
জি স্যার।
ভালো। এখন বলেন, কারো কোনো কোয়েশ্চেন আছে নাকি?
স্যার OSPE এক্সাম কি 22 তে?
22 তে, হ্যাঁ 22 আপনারা ঠিক 15টার মধ্যে সবাই রেডি হয়ে থাকবেন। ঠিক 15টায় পরীক্ষা ঠিক শুরু করে দেবো 9টার সময়। 9টা থেকে যত সময়ের মধ্যে শেষ করা যায়, এবং আপনারা সুন্দর করে সবাই একদম কিবোর্ড এগুলি সব ঠিকঠাক করে রাখবেন যাতে টাইপিং কোনো সমস্যা না হয় আপনাদের। ঠিক আছে? আর আপনাদের এখানে যে চ্যাট বক্স যেটা আছে ওইখানে তো আপনারা পাঠিয়ে দিবেন, তাই তো?
জি স্যার।
সুন্দর মতো এটা পাঠিয়ে দিবেন। পাঠিয়ে দেওয়ার পরে ওটা থেকে আমি সুন্দর করে আনসারগুলি বের করে স্যারদের কাছে পাঠিয়ে দিব। যা পড়ানো বলেন।
23 তে কি স্যার?
অর্থোপেডিক্স, আই এন্ড ইএনটি।
স্যার OSPE নাকি?
ওনাদের সাথে যোগাযোগ করেন, আমি বলতে পারবো না। ওনাদের সাথে সরাসরি আপনারা যোগাযোগ করবেন যে স্যার আমাদের